Hello, my name is Lauren. I'm a nurse practitioner. I understand you have some concerns about a genetic disease in your family.
Yes, I was adopted at birth, never knew my biological parents, but I got a DNA test and I found a first cousin. She told me my mother died in 2019 at 51 years of age from Huntington's disease, and she told me our grandmother and uncle also died of the same disease, my uncle in his early 50s in 2017, and my grandmother at age 43. My wife has been noticing mood changes in me lately. I'm having a hard time remembering things. I'm having trouble finding words and remembering dates or times. I'm really stressed about having Huntington's disease. And I have 2 young daughters, and I'd like to know the risks that I've passed the disease on to them. And I've probably been Googling too much, but I'm really stressed out.
Does your cousin perhaps know when your grandmother, mother, or uncle started showing symptoms? And do you have any details about the severity of their symptoms?
She thinks they started showing symptoms in their mid-30s, and she remembers my mother and uncle being difficult to be around personality-wise. They moved very strangely with jerky movements, and they both died in nursing homes. She doesn't remember our grandmother. She died before she was born, and she said I should probably get tested to make sure I don't have it, and she sent me this pedigree chart, and I'm not sure how to read it.
Okay, thank you for bringing this in. It looks like this is your family. You can see you and your wife here, and then your wife's family over here, and your family over here, and your mother here. And then here's your expanded family pedigree with your grandmother, your uncle down here, and your mother. And you are the yellow square here. Thank you for bringing that in. Do you know, are there any genetic conditions on your father's side of the family?
I reached out to my biological father. He said everyone is healthy on his side. But if I do have Huntington's disease, did I already pass it on to my girls? And if I have more children, will I pass it on to them?
We will start the testing with you to see if you have the genetic mutation that causes Huntington's, what we call repeat expansions on chromosome number 4. We will take a small sample of your blood and we'll look at your DNA to count how many of these repeats you have. Until we have those test results back, though, try not to be overly anxious. Once we have your results, I'll be able to give you better answers about your daughters and any future pregnancies. If we find anything, I'll probably want to refer you to a genetic counselor so they can give you the best advice. Now, if your test results come back positive, what will this mean for you specifically? Genetic testing is a great tool, but we don't really have a cure or even great treatments for Huntington's disease. We mainly just treat symptoms. The best we can do in many situations is delay the inevitable. Because of this, some patients choose not to know if they have the disease or not, kind of an ignorance or is bliss kind of situation. When we do have more comprehensive tests, we sometimes also find secondary and incidental findings that can have different impacts on your health and add to stress. We can even find what are called variants of unknown significance that we don't know what they do yet. But sometimes we get more questions than answers. On the flip side, knowing that you might have the predisposition towards something like Huntington's disease can take a toll on your mental health due to wondering if or when you might show symptoms. Are you okay knowing everything, even if the news may not be great?
Yes, I need to know for sure, and I want to be able to plan for my family and provide for them if I get bad news.
I understand. It's nice to know what we're facing here. And so based on your family history, we have 2 main options for testing. I'd probably like to order a targeted mutation analysis of the Huntington gene to look for abnormal replications that are specific to this disease. What we're looking for are called abnormal CAG repeats or repeat expansions. A normal test is 10 to 26 CAG repeats. And if your tests show over that, 36 to 39, it means you've inherited the gene, but there's a chance you won't show the disease fully. It's called incomplete penetrance. This means that the disease won't fully manifest itself and it will be mild. But if you have over 40 repeats, this means that you did inherit the gene and the disease will fully manifest itself. The normal Huntington protein that's produced by this gene is very important in our neuronal functioning, and it's essential to development. We're not 100% sure of everything that it does, but we do know it plays a huge role in our intercellular processes. And we do think it also may be a part of our DNA repair and cell protection. Our other option is to do one big comprehensive test called whole genome sequencing that will basically catalog all of your DNA. This will give us the most comprehensive information, but it's also more expensive, and sometimes we find those extra findings that we talked about earlier, and that can lead to tricky conversations. Which type of testing would you prefer? The specific targeted mutation analysis of just the Huntington gene, or would you like comprehensive testing?
I want the specific test. I'm fine not knowing all of the information. I just want to know if I have Huntington's disease. Will it be expensive? Will my insurance cover this?
I think the targeted mutation analysis sounds like the best plan. As for insurance, I'll have our nurse call to make sure it's covered. With your family history, it most likely will be. This is the most specific test that we can choose, and insurances are getting better at covering these. If it's not covered, the average cost is around $350 versus about $1,000 for the whole genome sequencing. This can still be a significant cost. Is that okay?
That sounds good. I want to get this done. I can afford $350. My insurance isn't great, but it's better than a lot of people have, I guess.
What is your insurance situation like? Do you have life insurance? Sometimes these life insurance companies can be ruthless if there's a diagnosis like Huntington's disease. They can even deny you coverage when you apply.
I have health and life insurance through work. I have long-term disability insurance through Aflac. It should be enough to care for my family if the worst happens. But will I lose my job if I get diagnosed with Huntington's?
I'm glad to hear that you have those insurances in place. There is a law called GINA that does protect against discrimination as far as health insurance and employment after you have a diagnosis like this, but it doesn't extend to life insurance and disability insurance. So I'm glad that you have those already. They are a good idea to have anyways. I would like to do a focused neurological and musculoskeletal exam on you today before I order any testing. Is that okay?
Yes.
Great. All right, go ahead and look at me. Go ahead and raise your eyebrows, puff out your cheeks, smile for me, and then stick out your tongue and move it from side to side. Good. I'm going to go ahead and look in your eyes. Any problems with your vision, hearing, or smelling? No. Good. Okay. I'm looking in your eyes. All right. And your pupil responses are normal. No abnormal eye movements. Go ahead and follow my finger. Good. All right. Good. All right. And then any abnormal sensations and numbness or tingling in your fingers or toes?
No.
Good. Okay. All right. No bruise. Heart and lung sounds are normal. Good. And go ahead and squeeze my fingers tight or as hard as you can. Push against me. Good. And push up with your feet and push down. I'm going to check your reflexes. Normal. All right. So no weaknesses that you've noticed. No problems with your balance, right?
Nope.
All right. And your gait looked normal when you walked in today. I'm going to go ahead and look in your mouth as well. Say ah. Okay. I'm just looking. I'm checking those cranial nerves. All right, now let's talk about these cognitive and mood changes that you've experienced. I did have our nurse do the SLUMS exam on you when you came in today. It looks like you scored a 26, which technically does show a mild neurocognitive disorder because you have graduated from college. This just looks for mild impairments. It isn't a full-on diagnosis, and it just gives us a baseline, but it is something that we'll need to look at.
How long will it take to get the results of the blood tests back, and will I schedule another appointment?
Yes, it'll take several weeks to send out the test and get those results back. Are you comfortable with me ordering them today and interpreting the test, or would you like to see a geneticist?
I'd like you to just order the testing. I understand the risks and benefits involved. I work in healthcare, and I know it's hard to see specialists, and it's hard for me to go to Boise and get off work, and I really don't like telehealth visits, and I'd still have to go to outpatient for blood draw.
That makes sense. As long as you feel that I've answered your questions appropriately and understand what the results may or may not show, I feel comfortable in ordering and interpreting these. But if the labs do come back positive, I would like to refer you to a geneticist and a neurologist so we have more people on our team taking care of you. Would that be okay?
That sounds fine. Let's wait and see the results, and I'll make a follow-up appointment in 1 month.
Yes, that'll be perfect. I'll send in the phlebotomist now to get a blood sample. If you could sign this informed consent and that I've answered your questions and you're okay with testing. All right, 1 month later. Hello, I'm glad to have you back in to discuss your test results. I have your targeted Huntington gene analysis report. We unfortunately did find some abnormalities on chromosome 4, specifically with the Huntington gene. Your tests showed that you do have 41 CAG repeats on the first Huntington allele. This is abnormal. We shouldn't have 41. Normal is less than 26. This is what a normal genetic CAG repeat should look like, and you have unfortunately too many. This is going to lead to your body creating abnormally long and mutated proteins and will cause symptoms eventually. So you do have Huntington's disease. Eventually the symptoms will show up and progressively will get worse. At this many repeats with 41, we do call this full penetrance, which means you'll have complete manifestation. I'm sorry, I know we were hoping for better news.
I'm a little confused about the repeats. What do they cause, and is this for sure? Is there any chance of a false positive? I was afraid of this.
The abnormal repeats in your DNA will cause this buildup of these abnormally long proteins, and they aggregate in your neurons in your brain and the basal ganglia mainly. And this causes neurons to die, and then you'll get cognition changes and musculoskeletal issues. Unfortunately, the likelihood of a false positive here is extremely low. This type of genetic testing is about 100% sensitive and specific for diagnosing this disease because it is found in such a specific spot on chromosome 4.
Did I get it from my mom for sure? How is this disease passed on? Could I have prevented it?
Your mother, uncle, and grandmother all had Huntington's disease, as we see from your pedigree, because it is passed on in every generation in what we call an autosomal dominant pattern. It's what we call a Mendelian disorder. And this means that it follows a very predictable pattern of inheritance and isn't really impacted by your environment, like some disorders that we would call multifactorial. This means that there was nothing you could have done differently and to not have this disease. It's not related to your lifestyle at all. So this is a Punnett square. This is what we use for Mendelian disorders. The big H is the allele that causes Huntington's disease. It is autosomal dominant, so it will dominate these small h's, which are the normal alleles. And you really only needed one copy of that dominant allele to get this disease, and you inherited that from your mother. So you can see here in the two boxes that this shows that your mother had a 50% chance of passing this disease on to you.
Wow, I have Huntington's disease. This is what I was worried about. Did I already pass it on to my girls?
So we would have to test their DNA to know for sure. You do have a 50% chance of passing on this allele with every child you have. And so there is a 50% chance with each of your girls that they do have this allele too, but we'd have to test them to know. But remember that there is also a 50% chance that you didn't pass it on. 2 out of 5 of your grandparents' children did not have the disease, or 2 did and 3 did not, as far as we know from your pedigree.
What kind of symptoms will I be dealing with?
The average age of Huntington's disease onset is 40, but it can manifest anywhere between 30 and 50 depending on how many repeats you have. Since you have 41, your onset appears to have started with the mood changes and the memory issues you told me about. Unfortunately, this is how Huntington's disease commonly begins, and this is something that you and your wife will both have to watch out and plan for. Huntington's also leads to cognitive changes and eventually severe dementia. It also unfortunately causes decreased coordination of movement and what we call chorea, which are purposeless, brief, dance-like movements. Initially, the chorea may just feel like restlessness, and then it will progressively worsen. These movement disturbances are due to an imbalance between dopamine and acetylcholine in the brain. These are chemical messengers, or neurotransmitters as we call them, that help regulate your movement as well as your mood and other brain functions. Huntington's disease can also cause hypotonia, hyperreflexia, and abnormal eye movements, which is why I checked your eyes and reflexes during our first meeting. The abnormal eye movements commonly show up in your young adult patients, but during our assessment, your eyes were completely normal. A lot of times the psychiatric symptoms will start years before the chorea begins, so you may have some time before those abnormal movements start. But because of the nature of this disease, depression is quite common, and so I want you to please let me or your wife or a trusted person know if you have any thoughts of harming yourself. The changes in cognition may get worse, with decision-making and ability and multitasking becoming more difficult. Be sure to be kind to yourself, be aware of your limitations, give yourself more time to do things, write things down so you remember them, and ask for help if you need it. Time-based tasks are especially something that patients with Huntington's disease do struggle with. The average length of survival after diagnosis is around 10 to 20 years, but some people live up to 30 to 40 years past the diagnosis if we get proper treatment and care. We will help you live a high-quality life for as long as possible.
What are the stages I will see with this disease?
There are 3 stages of Huntington's disease: pre-symptomatic, prodromal, and manifest Huntington's. Pre-symptomatic is where we know you have the expansion but no symptoms. We would say you're in the prodromal stage because you have the expansions, we know you do, and we are starting to see some cognitive changes. Manifest Huntington's disease is where you show more of the classic signs of the disease. In the early stages, you may not see many changes at all or even much progression. You'll be fully functional and independent. The middle stages are where we'll see a lot more progression. After the chorea starts and worsens, cognition declines, and you might need help driving, paying bills, and may have to decrease how much you work at your job. Some assistance may be needed with dressing, eating, and we have to watch for falls. In the latest stages of the disease, which I hope is really, really far off, you may need someone to care for you because of the loss of voluntary movement and cognitive decline. This is when families have to make very hard decisions to continue care at home or in a facility. We may start to see weight loss, and then eventually the chorea will affect your breathing, your diaphragm, and your larynx, so it'll make it hard to swallow and speak. But all of this said, the disease does take a different course for everybody. Some people have more movement disturbances and less mental decline, and some see the opposite.
What are the next steps I should take, and what are my options?
I'm going to refer you to a genetics counselor and a geneticist, Dr. Fleming in Boise at the St. Luke's Genetics Clinic, so you can go through more treatment options and they can follow you during the course of your treatment. I'm also going to send a referral to our neurologist here in Twin Falls, Dr. Steffens, and his colleague, Dr. Myers. Once you meet with them, they may order a CT or an MRI to assess the basal ganglia in your brain and what exact stage you're in. I'll send the referral today and get you under their care as soon as possible. There are also treatments we can try, like neuroleptic medications that Dr. Steffens and Dr. Myers will be well versed in. These medications typically try to regulate dopamine and serotonin levels in the brain and help with the movement and the balance problems. We also have a medication called tetrabenazine that may possibly be used. Antidepressants can be used to help regulate serotonin as well and can be helpful in depression. The scientific community is working on gene editing and gene splicing therapies all the time that may help eventually treat Huntington's disease and help clear the abnormal proteins. And we are making huge strides in this field all the time, so we don't want to lose hope. We also have pharmacogenetic testing that we can do to see which medications you'll respond to best, with just a sample of blood. There are several ongoing trials for Huntington's disease, and I'm hoping we can get you into one of them. And we may have to order speech therapy, occupational therapy, and physical therapy as the disease progresses. With your children, we want you to talk to the geneticist to see about getting them tested. Huntington's usually shows up between 30 and 40 years old, so it may not be something to worry about with them presently, but it can become more insidious with each generation, sometimes called anticipation, so we do have to be very mindful of that. We definitely want to take care of your mental health and that of your wife. Do you have a therapist or a counselor already?
No, I need a referral to a counselor, and I'm going to look into support groups.
Good. I understand that this is a lot to take in. Our whole office will be there for you, whatever you need. I know that this is a lot to think about and unpack. Please go home and talk with your wife. I'll send all the necessary referrals, and I'd like to see you again in 3 months. Please make that appointment as you leave. And do you have any other questions?
No, thank you for being forthcoming with me.
All right, here's some more information on Huntington's disease. Thank you so much for coming in.